I want you to be in the driver's seat. This is your treatment. I'm here to guide you. This is your treatment. I want them to feel that. I want them to have the autonomy to feel that. You bring in the goal, you tell us what you want to do, and we will work with you. We will try our hardest to get you to that point. Psychoeducation about medications is really, really important to me. I want the clients to know what medications that they're being placed on and why. Like, they should be able to step out of OPI, out of Embark, and be like, I'm on this medicine for this reason, and this is how it works. So I want to empower them to have that knowledge, and then they're going to feel a lot better about why they're taking the medications, and feeling better about sharing it with their loved ones. I have an open door policy. That's like really important to me. Like, if my door is open, like, come in, let's talk, whatever's on your mind. So people are coming in and out, in and out. You know, we're always talking about clients all week long and making sure that we are firm on our plan, and that way we have success, and the clients are getting the same message consistently across the board. The most important thing in life is making human connections. The connections that I make at work are really, really special to me. And everybody has a different story. Take one person a young adult who came to us with pretty profound psychosis. And this particular client would not talk to us using their voice, would only communicate by writing it down on a piece of paper and showing it to, everybody around the office, if they communicated. There were delusions, there were hallucinations, a lot going on. You could see that this individual was really stressed out by their symptoms and pretty overwhelmed. I remember the first day I met this individual, and I got them to break that rule to writing down things and actually speak with their own voice. And it simply had to do with, like, I noticed they were wearing like really cool sunglasses, and I was like, wow, like, you are styling with those sunglasses. And that individual ended up, laughing, smiling, and kind of, that brought some ease into our conversation. And then from there, it was kind of like small little bits and pieces, like, what is stressing you out? Like, what is going on, etc. We were able to get the client on a long-acting injectable antipsychotic medication, in addition to addressing their anxiety symptoms, working with a client on therapy for the delusions and paranoia. And coming out of short-term, the client was having no issues with communication. In fact, was like talking to everybody around them. Symptoms were much improved, so much so that the client was fully aware when they were having hallucinations, when a thought might have been a delusion, was able to share it with the next person, help them understand, and could talk about it. It was one of the most incredible 90-day turnarounds I've ever seen, and the degree of insight that this individual showed just like blew me away. And a lot of it had to do with, like, we got the meds in at the right time, right? Like, awesome. But everybody in the house was so invested in the care of this individual. And because of that genuine, like, care for this person, the turnaround was so good, and the trust was built, and he came out of it doing great. When someone has a mental health issue, struggle, illness, they are at their most vulnerable. Most vulnerable. And if they come into my office and ask me for help, just to be a part of that journey means a lot to me.